And there is nothing that is too silly. There is nothing that is not big enough. I think the biggest thing that I see in my community and my kids' communities and in office is that we wait until things are really, really hard. And I think that's the part that we don't have to do. Unfortunately, a lot of people think that, but be more proactive. In society in general, we come into more of like a reactive mode of when we are sick, we fix it, right? We are sick, we take care of it, or we work through it. Or when something's broken, we go to the doctors and they fix it. You got a broken leg, you're going to the orthopedics and you're going to go see the doctor. You might get x-rays and cast and then we have to be off of it. Maybe there's some physical therapy. So there is a guideline to do that and we know where that will end. I think mental health is very different because it takes an individual approach for each person, a different plan for each person, whatever fits their lifestyle, whatever fits their maybe motivation at the moment, interest at the moment, whatever their biggest struggle is at the moment, whatever things that they are up against. It really takes kind of diving in and working with them. I always say that I'm on my patient's team. They're not on mine. I'm on their team to kind of help them and I want to walk with them like on their journey to kind of help them move in that right direction.
Welcome to the Wing Space Podcast, a place to take up space where we talk about all things wellness, from nutrition to movement to sleep and stress and so much more. With me, your host, Jennifer Voorhaar, along with special guests and experts within our Hope and Healing wellness community. Let's jump in.
This podcast is not a replacement for mental health treatment or professional health care. In case of crisis or emergency, please contact your local healthcare provider or dial 911.
Hey there, and welcome to the Wing Space Podcast, a place to take up space. I'm your host, Jennifer Voorhaar, and on today's episode, I am very excited to welcome Michelle Schall, who is our newest addition to our team. She is a nurse practitioner. And Michelle, I'm going to let you introduce yourself and all of your amazing credentials, because I certainly don't want to mess that up. But before we jump into that, I do want to just ask listeners if you could please like and subscribe. It really helps us. So go ahead and do that. And Michelle, welcome to the podcast.
Thank you. Thank you. I am so excited not just to be on this podcast, but I am super excited to join the team. I think everything lands where it's supposed to be in mysterious ways, and I'm definitely a believer of that. So I'm super excited for the next part of the journey. My name is Michelle Schall. I am a certified pediatric nurse practitioner, and I also hold a certification as a primary care mental health specialist. What that means is I can see children as a nurse practitioner between the ages of 0 and through 24 has been the new definition of what a pediatric mind is. And I think that's important to say because that's changed over the time that I've been practicing, a little bit. And then that kind of goes with not only primary care perspective, but then also throughout mental health too. So, which, as we know, that affects everybody at all ages and walks of life.
So as a nurse practitioner, for those of our listeners that may not know this, you didn't start as a nurse practitioner. You started as a nurse and you made your way into the nurse practitioner role in the primary care setting. And here you are now in the mental health setting. So do you want to take us back a little bit in terms of what got you into nursing and of your journey to where you are today?
Yes, I won't go way back, but I'll say in elementary school, I was definitely the one that wore the nursing cap, and my mom dressed me in the white, and I had a stethoscope for career day in elementary school. So I guess I've been blessed that I have always known that I wanted to go into, I don't want to say healthcare, but I think helping people in some way. I think that's always been a piece of me with just empathy for others and wanting to care for others. And it really filled my cup, even being younger. And of course now, even at my age. So that gives me such joy is helping other people. So I haven't had any other thoughts of what else to do, but went into nursing. And then I started in the ICU, the neonatal ICU, actually first. So taking care of like really premature infants and then those with birth trauma and other things that did come their way, unfortunately. And I did love being at the bedside, but then I also truly appreciated the families and the things that they were going through in those moments. The positives, I love the positives, right? All babies are great. Then it's also the moments of trauma, the other things that really made a negative effect on their lives or affected them in some way, shape, or form. I knew that I didn't want to stay within just in the newborn realm. I knew I wanted to expand into peds and just kids in general. So I did go to the pediatric ICU, still in intensive care nursing, but I wanted to see more ages. And so in the pediatric ICU, I did a lot more. So a lot more through into the age 21, so into young adults. And this would be through major surgeries, organ transplants, traumas, accidents, you name it, that I come in. So you're in intensive care for not a positive reason at that aspect. And I always felt that one, I loved medicine. I loved to be at the bedside and caring for them, but I loved helping the families and to be the person that they trusted when they left the bedside to go eat, go sleep, go do whatever it may be. And so I feel like there's like a piece of that that still has always been with me. I did want to come out of the intensive care realm at some point. So I did go into primary care and I wanted to be on the other end. So what's the before end before these big events happen, before this maybe traumas have happened in their lives, or other end of chronic care management and helping the families grow and the kids really grow and thrive. And the kind of the wellness side excited me into a different place I want to be a part of. So I was in primary care for the past 13 and a half years. And amazingly enough, mental health has really come into play over and over, visit after visit. And I am here today because I've been able to help, help these kids as much as I've been able to help them. And I just want to take that deeper dive into helping them with their care in a more comprehensive and integrative way and lifestyle medicine and what may really, really benefit them whenever they're having struggles going through things or just to better themselves and their families.
Yeah, that's awesome. It's interesting. Our careers have kind of taken similar paths. Mine as a social worker and yours as a nurse. I started in CPS and foster care and kind of critical incident response, and then decided that the stabilization and the wellness piece is where I wanted to kind of settle in this period of my career. And so I'm just so grateful that we were connected and that we were able to bring you onto our team, because I think that one of the pieces that we have been missing within our practice here at Hope and Healing is the medical piece. We aren't necessarily of the medical model because we look at health and wellness differently than the medical model does. But having the medical perspective, the nurse practitioner perspective, certainly having a prescriber is a benefit to us. And it's something within our community that um, we don't have enough of. But having you be on our team is more than just bringing you on as a prescriber. Tell our listeners a little bit about this holistic approach that you are taking in terms of this whole person assessment, and how is your work different?
Sure. Yeah. And obviously, I am like conventional and traditional medicine trained. And I feel like that is evidence based medicine and that is absolutely necessary, for all people along the way. I think in that training, though, it gives us little bits to be able to help in from the other ways, such as diving deeper into diet and sleep and all the other pieces in there's so much more, and I can go into it a little bit, but diving into all the pieces, what makes a person a person. And it's not just about the number of symptoms that they have or maybe what medicine that may help or other things. But I really feel, and I see this in my practice, where I think in society in general, we come into more of like a reactive mode of when we are sick, we fix it, right? We are sick, we take care of it or we work through it. Or when something's broken, we go to the doctors and they fix it. You got a broken leg, you're going to the orthopedics and you're going to go see the doctor. You might get x-rays and cast and then we have to be off of it. Maybe there's some physical therapy. So there is a guideline to do that and we know where that will end. I think mental health is very different because it takes an individual approach for each person, a different plan for each person, whatever fits their lifestyle, whatever fits their maybe motivation at the moment, interest at the moment, whatever their biggest struggle is at the moment, whatever things that they are up against. It really takes kind of diving in and working with them. I always say that I'm on my patient's team. They're not on mine. I'm on their team to kind of help them and I want to walk with them like on their journey to kind of help them move in that right direction. A piece of that is first looking at the whole approach. So I kind of like a comprehensive exam, essentially. So we're going to look at all pillars of their holistic being, and that is between physical health, mental health, emotional health, their social community in home and school and peers, work, whatever that may be for that person. And then spiritually too, where are their needs or where are their challenges or what strengths do they have that we can pull from each pillars of health to kind of put in to help them be the best version of themselves and to face whatever challenges or unveiling maybe what causes are leading them to the reason why they're here.
One of the things that I love about, and I say one of the things because there's so many, but one of the things that I love about bringing you on the team is that when we were creating your forms, we basically took our mental health forms and added the physical piece of it, right? Because that's outside of our scope as therapists. So you are still looking at all of the components that we as therapists are looking at in terms of sleep, diet, relationships. We're looking at stressors, history, all of the things. We don't live in a bubble and we have so many variables. And you're looking at all of those things too. I remember when we were first having some of our initial conversations, you made the example that the child that's coming in for behavioral or attention issues, you're going to make sure that there's not some tonsils or adenoids that are impacting their ability to sleep, which is impacting their ability to be well rested, to go to school and to participate and pay attention, right? So, whereas a prescriber from a very medical model might say, oh, here's a child that has ADHD symptoms, let's give them a stimulant. You're going to look at what are some other contributing factors that may allow us to not use medication as a first line of defense.
Right. Right. Absolutely. And most parents don't want medicine as a first line of defense. Like I'll say it too. And I think, we're all in a place where like, what can we do? I think the part is that we just don't know. And I think our society doesn't promote us to live the best version regarding diet and exercise and other bits too. I think just from life stress and where we are. So I think that does change a lot of our routines in life. As parents, I keep saying as parents, I know because I talk about peds a lot, but I mean even teens. And I love working with teens. I love working with the young adults when they're on their own and they're figuring out their own routines and rituals, but they still want to hang with their people and they still want to go out to eat a bunch and then in the parent side of things is like you're the one who we are the homemakers. We're the one creating the environment of either the nutritional environment, what we're packing in the lunches, or maybe we have work at different times, practices at different times. So what are our schedules within the house and other bits, but specifically related to like when they come in and we want that quick fix, everybody wants a quick fix. Hello, we all do. And sometimes that is the case. Sometimes it's little tweaks of things that come along. And absolutely, sometimes it is medicine. Medicine is a great tool that can be so helpful for so many people, but it's not always the first tool. Or if perhaps it is, then there are other things that you're going to walk away with, from Hope and Healing in these appointments. There's going to be other things that are going to help benefit, not just in the short term, but the long term, whether that be for, I said, the client, the person, the child, the young adult, or even the parents, what are some things that we can put in place to kind of make our home a better place?
So it's not just, vital signs and, heights and weights and things like that. They're getting a pretty comprehensive assessment from you.
Yes, I'd like to do as I said, this is the physical piece where I know that metabolically some things make changes to our mental health, our physical health, our mental health, or whether that be our thyroid. Is it maybe we have markers for type 2 diabetes? That means like insulin resistance. And a lot of times that can just wreak havoc on your body, wreak havoc on your mind. So doing a physical exam, we don't get in gowns. We don't do anything like that here. It's not like a normal doctor's office, but it's within enough that helps me get a better picture from a physical standpoint of how the patient is. I like to dive in on looking at, are there any chronic illnesses? Are there any chronic illnesses that you may suffer with, whether that be thyroid disorder, whether that may be chronic stress? I hate to say that as an illness, but where we're at. So like chronic stress and the way that we're dealing with that. So again, it's just peeling back these onion layers on each person to see what kind of makes them be their own being, their symptoms and their strengths, using those to work for them too. I love to look at the family dynamics or their social dynamics, their work dynamics. What contributing factors does that have to them and how they feel and function, in life? So that's a big piece of it. Again, that's a whole pillar of health, when we think about from a holistic perspective. So looking at the whole person and in these modalities really helps to move from a surface view and kind of to a deeper level of understanding. I guess I should say when we think about like there's different types of medicines. We talk about conventional medicine, we talk about traditional medicine, that is Western medicine, evidence-based practice, guidelines, again, like super important for our healthcare. Integrative medicine means using that and then integrating in complementary therapies. So massage, yoga, breath work, acupuncture, aromatherapy, movement, nutrition. So it's using other aspects, which we have here at Hope and Healing, to accent and really kind of help a person move on to where they really want to be. Holistic health is putting in just all aspects. So all those pillars of health, like I'd mentioned, physical, mental, social, spiritual well-being, environmental, what else is going on in your environment. So lots of other bits. And I feel like bringing these all together just makes a complete approach for the person.
So when you're talking about looking into those complementary alternative interventions, you're really speaking our language here at Hope and Healing, because it is the wellness piece of the work that we do. Because, Hope and Healing came about, and the wellness wing and the podcast all came about because we know that there is more to healing and to wellness than just talk therapy. And we know from a medical perspective, there's more to it than just prescribing medication. So, um, for those listeners that have been following along with the podcast for a while, and if you haven't, I encourage you to go back and listen to other seasons and other episodes. But I've had conversations with other experts and episodes where we've talked about different components of wellness and different aspects of like how it all fits together. And that's exactly what, Michelle, you're talking about. And you're looking at each of those components of wellness, because if one thing isn't working, then it's potentially impacting all the other ones.
Absolutely. And I think that leads me to another big piece of what I love to do is one of my favorite parts is teaching kids, teaching parents about their kids, and then teaching, young adults what is happening in their body, what is happening physically that they are experiencing mentally, they're experiencing emotionally, behaviorally, whatever that may be. So what is physically happening from one brain development, depending on age, maturity, delays? Is there any developmental things in the past that may be causing them problems with maybe where they are, at that age or in development? How their brain, how their mind connects with their body, and how they can use it as a tool if they can't tap into their mind. Sometimes, like have multiple patients who are going to therapy, and sometimes they just can't engage, or they feel like they are just hitting a wall, or they perhaps really have a hard time. Maybe their anxiety doesn't allow them to move forward with a therapy that they really want to do and they really need to do. Sometimes, one, can we tap into the physical being? That means a couple things. Can be medicine, not always. And that also can mean, we need better work on nervous system regulation. Do we need to help with parasympathetic nervous system? That's our rest, our digest, our regulate. That's the part that kind of works against our fight or flight, our stress responses that are there. So overall, when we've built these habits within ourselves, mentally and physically, and all these things come up, our body just goes into protect mode and we tries to protect us all the time. So sometimes understanding, not like listening to the emotion that's there, but let's pay attention to our body first and let's fix our body. And then our mind can be headed in a better direction too. So I love working with understanding that, teaching parents understanding what ADHD is like. So understanding it is not just you have a kid who is defiant and bouncing off the walls, won't listen, can't remember to do anything, doesn't want to do schoolwork or this and that. I'm like, no, this is executive dysfunction. This is trouble starting a task, finishing that task, following through, the structure maybe of the routine of the day in school and other things too. So how can we help adjust like some of that to help them be the best version of themselves in that moment? And then ultimately, when I see people, if I make a diagnosis, then perhaps it is, and that's evidence-based, and I'm going to say, here is why perhaps this diagnosis is made. If there's not a diagnosis, here is why. This is why you're not making a diagnosis. If a diagnosis is made, it's not a label. It's not a label. It doesn't put you into a stereotype box. It's not like, well, that's okay because I have this or other things. It really is just to give us a clear tool for clear understanding, essentially. So giving them a support system that is backed by evidence and backed by conventional medicine, backed by all the other things that we know what to do, and then incorporated with all other aspects of of lifestyle medicine that we can do to kind of support not only the patient, but the family. I mean, I have 3 kids. We know whenever one part of the family unit is off, everybody feels it. So a lot of times, working with families as well as the patients, whenever we are coming down to after that assessment, where do we go next? And that's creating that treatment plan, which encompasses all that we can offer.
Well, in addition to, seeing you doesn't mean you're going to get medication. It doesn't mean you're also just going to slap a diagnosis on someone, and send them on their way. You're going to use that integrative approach to use assessments and have those conversations and also educate not only the client, but their parent about why or why not there is a certain diagnosis, how they can help themselves. I think sometimes clients are more likely to follow through with an intervention that we recommend if they understand why. Why are you telling me that I need to go for a walk for 10 minutes a day? If I explain why, fresh air, sunshine, and movement are vital to our, well-being of our physical body that impacts our mental health, they're more likely to do it.
Mm.
So
Yep.
that's really a part of your process.
Yes. Yep. Yeah, it's not understanding what's going on, but why is it happening and how can they move forward in a sustainable way?
Yeah, and we're all a part of a team together because, ultimately we want them to find wellness and healing of whatever it might be that they potentially need healing from, or just overall wellness. We want our clients to find that, and we're in a team together. I mean, it would be kind of an interesting day if we were, out of jobs, right? Because everybody had all the wellness that they need. They were at peak performance. What's the word? Optimal performance.
Mhm.
But that's just not the world that we live in. And so we want people to be well, and we want people to find what works for them, the combinations and the interventions that work best for them. Because what works for you doesn't work for me, and vice versa. So it has to be very individualized as well.
Yeah. And I think that's part of the coolest part for me. So I hate to say it's cool when I talk about all of this, but I think this is what intrigues me the most. And I love these visits. And like I said, they light me up in a personal way of being able to navigate, of peeling all the onion layers back. What do we have? What's going on? And then how do we put all these supports back in place, to them? And so it looks very different for everybody. And that's what I love. And sometimes I'm relating things to baseball, sometimes it's anime, sometimes it's who knows, whatever that person may be interested in. So she's like, it's absolutely just meeting the patient, the client, the family where they're at, which makes it cool every time.
Yeah, that's awesome. And you're listening. You're listening, you're looking at the whole picture. Sometimes we engage with providers that we just don't feel like they heard us. They don't listen to us, right? And that's not what folks are going to find when they work with you. Of course, that's not what they're going to find when they're working with any of our providers here at Hope and Healing. I pride myself on that. But you're really coming at it not only from that Western medicine evidence based and experience, but also, kind of let's look around the corner at what else there is. And you said peel back the layers of the onion, right? And it immediately made me think of Shrek, working with peds, and I'm thinking about kids shows.
Yeah. I think the other piece of it too is what I love about, having worked in pediatrics is seeing the brain development throughout the years. So in a preschool age brain, this is normal functioning. These are normal things to expect. And elementary school years and middle school years and teenage years and young adult years, and seeing the changes that happen from executive functioning, emotional changes, hormone changes, all the things that may come about, and just helping somebody navigate through any or all aspects of their life, like that. It's cool. It's really cool, to see like how a person develops and how we develop, and then how we can fuel our ourselves in all of our pillars of health, essentially, to kind of bring it down to it. Like, how can we fuel ourselves and to be the best us?
Yeah, I love that. I am so excited to have you as a part of our team, Michelle, not only here at Hope and Healing to provide services to our clients, but I think you're going to be a wealth of knowledge to our team and here as a guest on our podcast. So for our listeners, this is not the last time you will hear from Michelle. I'm sure we will have more opportunities to have conversations. Any last minute thoughts that you want our listeners to have before we wrap up today's episode?
I know we talked a lot broad spectrum things today about different aspects, but I think that if you are just even uncertain, I feel like I would see a lot of people in the primary care realm when I was there in the office who just didn't know where to start. And absolutely, Hope and Healing can be a fantastic place to start. So, one, even with myself, I'm happy to even see what would be helpful, not always to create a long term relationship, but even just, hey, what's going on, in my bodies or something, or where can I go for, the next step, for me too. So, and there is nothing that is too silly. There is nothing that is not big enough. I think the biggest thing that I see is in my community and my kids' communities and in office and everything else too, is that we wait until things are really, really hard. And I think that's the part that we don't have to do. Unfortunately, a lot of
Yeah.
people think that, but be more proactive.
Yeah, absolutely. And our purpose in doing this podcast and our hope is that each episode includes just a few nuggets of goodness for those of you that tune in. So I hope that this episode provided that to you. And if someone in particular came to mind while you guys were listening and tuning in today, go ahead and share this episode with them because we want to share all that we can there. So thanks so much for listening. Thanks for being with me today, Michelle. And I hope you guys all have a great day.